Top 3 vitamins that help stop proteinuria and heal your kidneys. Proteinuria is a condition that signifies the presence of excess protein in the urine. Under normal circumstances, urine contains very little protein. However, when the kidneys are damaged or not functioning properly, they may allow larger proteins to pass through their filters and enter the urine. This condition can be indicative of various underlying health issues, particularly those related to kidney function. It is essential to understand that proteinuria is not a disease in itself, but rather a symptom of potential kidney damage or other medical conditions. The kidneys play a vital role in maintaining overall health. They filter waste and excess substances from the blood, regulate electrolyte balance, manage blood pressure, and produce hormones that are crucial for producing red blood cells and maintaining bone health. When proteinuria is present, it can indicate that the kidneys are not performing these functions effectively. Persistent proteinuria may lead to kidney damage over time, resulting in chronic kidney disease or even kidney failure if left untreated. While conventional treatments for proteinuria often include medications and lifestyle changes, there is growing interest in the role of vitamins and supplements in supporting kidney health. Vitamins can serve as valuable adjuncts in managing proteinuria and promoting kidney function. In this discussion, we will explore 3 essential vitamins: vitamin D, vitamin B6, and vitamin C, highlighting their roles in kidney health and their potential effects on proteinuria. Vitamin D is well known for its role in bone health, but it also has significant implications for kidney function. It is crucial for maintaining calcium balance in the body and has been shown to possess anti-inflammatory properties that may benefit kidney health. When the kidneys are functioning well, they help convert inactive vitamin D from the diet or sunlight into its active form, which is essential for calcium absorption and bone health. However, in individuals with kidney dysfunction, the conversion of vitamin D can be impaired, leading to deficiencies. Research has indicated that vitamin D deficiency is common in people with chronic kidney disease, CKD. Low levels of this vitamin have been associated with increased proteinuria, suggesting that adequate vitamin D may help reduce protein leakage in the urine. Some studies have shown that supplementation with vitamin D can lead to improvements in kidney function markers, including reductions in proteinuria. The recommended daily intake of vitamin D varies depending on age and individual health conditions. For most adults, a daily intake of 600 to 800 IU is generally recommended. However, individuals with kidney disease or those at risk of deficiency may require higher doses, which should be determined in consultation with a healthcare provider. Dietary sources of vitamin D include fatty fish such as salmon, mackerel, and sardines, as well as fortified foods like milk, orange juice, and cereals. Sun exposure is another important source, as the skin synthesizes vitamin D when exposed to sunlight. However, it is essential to balance sun exposure with the risk of skin cancer. While vitamin D is generally safe, excessive intake can lead to toxicity, resulting in elevated calcium levels in the blood, which can have detrimental effects on kidney health and overall well-being. It is crucial to adhere to recommended dosages and consult with a healthcare professional before starting any supplementation. Another vitamin that plays a significant role in kidney health is vitamin B6. This water-soluble vitamin is essential for various metabolic processes, including protein metabolism. Vitamin B6 helps the body use amino acids effectively and is involved in synthesizing neurotransmitters, hemoglobin, and other important molecules. It also has a role in reducing inflammation, which can be beneficial for kidney health. Emerging research suggests that vitamin B6 may have a positive impact on proteinuria. Several studies have shown that individuals with chronic kidney disease often have lower levels of vitamin B6, and supplementation may help improve kidney function. For example, one study found that higher dietary intake of vitamin B6 was associated with lower levels of proteinuria in patients with kidney disease. This effect may be attributed to vitamin B6's role in regulating homocysteine levels, an amino acid that, at elevated levels, can contribute to kidney damage. The recommended daily intake of vitamin B6 for adults is about 1.3 to 2.0 milligrams, depending on age and sex. Foods rich in vitamin B6 include bananas, chickpeas, potatoes, and various meats and fish. Including these foods in your diet can help ensure adequate intake of this essential vitamin. While vitamin B6 is generally safe, excessive supplementation can lead to nerve damage and other health issues, so it is essential to approach supplementation with caution and seek guidance from a healthcare professional. Vitamin C, also known as ascorbic acid, is another vital nutrient that contributes to kidney health. This powerful antioxidant plays a crucial role in protecting the body from oxidative stress, which can damage cells and tissues, including those in the kidneys. Oxidative stress is often elevated in individuals with kidney disease and may contribute to the progression of proteinuria. Research has shown that adequate vitamin C levels may help reduce inflammation and improve overall kidney function. One study found that patients with chronic kidney disease who were supplemented with vitamin C experienced significant reductions in proteinuria and improvements in other markers of kidney health. The antioxidant properties of vitamin C help neutralize free radicals, potentially reducing the oxidative stress that can harm kidney cells. The recommended daily intake of vitamin C for adults is approximately 65 to 90 milligrams, with a tolerable upper intake level of 2,000 milligrams. Dietary sources of vitamin C are abundant and include citrus fruits, strawberries, kiwi, bell peppers, and broccoli. Incorporating a variety of these foods into your diet can help ensure adequate vitamin C intake. While vitamin C is generally safe, high doses can lead to gastrointestinal upset and may interact with certain medications, so it is advisable to consult a healthcare provider before starting supplementation. Integrating these vitamins into your daily routine can be beneficial for managing proteinuria and supporting kidney health. A balanced diet rich in whole foods is the best way to ensure you get the necessary vitamins and nutrients for optimal kidney function. In addition to the vitamins discussed, it is important to include a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats in your diet. Staying hydrated is also crucial for kidney health. Drinking enough water helps the kidneys filter waste and prevent the formation of kidney stones. It is generally recommended to drink at least 8 8-ounce glasses of water daily, but individual needs may vary based on activity level, climate, and health conditions. Regular physical activity is another essential component of maintaining kidney health. Exercise helps control blood pressure, manage weight, and reduce the risk of chronic diseases, including diabetes and heart disease, which are risk factors for kidney disease. Aim for at least 150 minutes of moderate intensity aerobic activity each week, along with strength training exercises on 2 or more days. If you are considering vitamin supplementation, it is essential to consult with a healthcare professional, especially if you have existing health conditions or are taking medications. They can help you determine the appropriate dosages and assess potential interactions with other treatments. Additionally, it is crucial to be mindful of the quality of supplements. Choose reputable brands that undergo third-party testing for purity and potency. While vitamins can play a supportive role in managing proteinuria and promoting kidney health, they should not replace conventional medical treatments. It is vital to work closely with healthcare providers to develop a comprehensive treatment plan that addresses the underlying causes of proteinuria and supports overall kidney function. In conclusion, addressing proteinuria and supporting kidney health requires a multifaceted approach. Vitamins such as vitamin D, vitamin B6, and vitamin C can provide essential support in managing proteinuria and enhancing kidney function. These vitamins offer various benefits, including anti-inflammatory effects, antioxidant protection, and improvements in protein metabolism. Maintaining a balanced diet, staying hydrated, and engaging in regular physical activity are critical components of a healthy lifestyle that supports kidney health. As with any health-related endeavor, seeking guidance from healthcare professionals is essential for personalized advice and effective management of kidney health. By taking proactive steps and being mindful of your nutritional needs, you can support your kidneys and overall well-being, helping to prevent and manage conditions like proteinuria. If you are dealing with proteinuria or any kidney-related issues, consider discussing these vitamins and dietary strategies with your healthcare provider. They can help tailor a plan that aligns with your individual health needs and guide you on your journey to better kidney health. It is essential to remain informed and proactive about your health, as the kidneys play a critical role in maintaining overall bodily functions. By prioritizing kidney health, you can improve your quality of life and enhance your overall well-being. This holistic approach not only addresses the symptoms of proteinuria, but also promotes long-term kidney health, empowering you to take charge of your health journey. Whether through dietary choices, supplementation, or lifestyle changes, each step you take towards improving your kidney health can have a profound impact on your overall health and quality of life.